The elbow is a complex joint formed by the articulation of three bones, the humerus, radius, and ulna. The elbow joint helps in bending or straightening of the arm to 180 degrees and assists in lifting or moving objects. The bones of the elbows are supported by ligaments and tendons, muscles, nerves, blood vessels. Bones and joints of the elbow joint. The elbow joint is formed at the junction of three bones. The humerus, upper arm bone, forms the upper portion of the joint. The lower end of the humerus divides into two bony protrusions known as the medial and lateral epicondyles, which can be felt on either side of the elbow joint. The ulna is the larger bone of the forearm, located on the inner surface of the joint. The curved shape of the ulna articulates with the humerus. The radius is the smaller bone of the forearm, situated on the outer surface of the joint. The head of the radius is circular and hollow, which allows movement with the humerus. The connection between the ulna and radius helps the forearm to rotate. The elbow consists of three joints from articulation to the three bones, namely, humero-ulnar joint is formed between the humerus and ulna and allows flexion and extension of the arm. Humero-radial joint is formed between the radius and humerus and allows movements like flexion, extension, supination, and pronation. Radial ulnar joint is formed between ulna and radius bones and allows rotation of the lower arm. Articular cartilage lines the articulating regions of the humerus, radius, and ulna. It is a thin, tough, flexible, and slippery surface that acts as a shock absorber and cushion to reduce friction between the bones. The cartilage is lubricated by synovial fluid, which further enables the smooth movement of the bones. Muscles of the elbow joint. There are several muscles extending across the elbow joint that help in various movements. These include the following: biceps brachii, upper arm muscle enabling flexion of the arm; triceps brachii, muscle in the back of the upper arm that extends the arm and fixes the elbow during fine movements; brachialis, upper arm muscle beneath the biceps, which flexes the elbow towards the body; brachioradialis, forearm muscle that flexes, straightens, and pulls the arm at the elbow; pronator teres. This muscle extends from the humeral head across the elbow and towards the ulna and helps to turn the palm facing backward; extensor carpi radialis brevis, forearm